It's a move many believe is long overdue. North Carolina today naming every nursing home and long-term care facility with a COVID-19 outbreak. The latest outbreak at Autumn Care of Marshville in Union County. There are 64 cases with 5 deaths there, and the largest outbreak by far at the Citadel Salisbury with at least 144 positive cases and 10 deaths. State officials releasing that information after the defenders Nathan Morabito and other journalists push for more transparency.
Newly released state records show in our area alone, nursing homes and other healthcare facilities account for 477 cases and 42 deaths. Each case represents a person and a family. But advocates say the added transparency will provide some comfort and end needless uncertainty.
It's not like I can drive up, pick him up and take him out.
We've heard their stories of fear and pain.
I struggled with a bit of anger that I didn't know he was sick, first of all, that no one called me.
For much of this pandemic, families have remained completely at the mercy of nursing homes and health departments to keep them informed, a system that proved inconsistent and inefficient at times.
There's already stress with caregiving, and then you pile this on top of it, and we've got to do whatever we can to make it less stressful and support our caregivers.
The AARP says information is critical when it comes to caregiving. That's why the North Carolina chapter sent a letter to the governor last week requesting more transparency.
They really need to know during this time of COVID whether their loved one's facility is affected or not.
We will continue to evaluate this. We have heard multiple times folks want more information. I hear that.
In an interview with us earlier this month, Dr. Mandy Cohen left the door open for the state to name congregate living facilities with outbreaks at some point.
We want to make sure that that information is standardized. We saw a patchwork quilt of information released across the state. We hope this will be helpful to folks as we go forward.
It took longer than some would have liked, but the health secretary announced Monday the state has reversed its stance, identifying dozens of facilities across North Carolina, along with the total number of cases and number of deaths at each location.
The report will be updated twice per week.
Names and numbers the state will update regularly.
As this pandemic evolves, we will continue to assess the appropriateness of data reporting to balance transparency, public health, and individual privacy.
If you had any doubt about the importance of this information previously protected for privacy reasons, consider this. Right now, in the state of North Carolina, about half of the COVID-19 cases stem from nursing homes and long-term care facilities. Nate Morabito, WCNC Charlotte.